I heard
I'll have
something.
a second thoughts.
Alright, well, I'm just gonna drop out now after that.
Yeah, why don't you go
She's
make a
interesting. I know.
Any effects, so.
Okay, Kim, you ready? All right, Clay, here on the set, please. Go ahead. Thank you.
Alright, so this is Shauna. She is a healthcare aide and in the nursing program right now. And I wanted to ask her about what are your opinions on vaccinating children?
I think vaccinations is something that's highly debatable in today's society. When it comes to kids, I think it's something that should be mandatory. When you're young, and especially when you're in school, and you have little snot-nosed kids running around and they don't wash their hands and they put things in their mouths and they do things because they're experimenting, and those are the reasons that kids get sick. And immunizing them and vaccinating them against diseases and things that their bodies are more prone to because they don't have that immunity in their body is like super important.
In your work as a healthcare aide, have you ever seen anything that could have been preventable with the vaccination?
Yeah, you see it a lot.
A lot?
The flu is like, in seniors, the flu is insane. It knocks them right out. And a lot of them have this stigmatism that when you get the flu shot, you get sick. And it's not true. You don't get sick from the flu shot. Usually if you get sick after you've had it, it's because you already had the symptoms. But they have that idea in their head, so they won't get the flu shot. And then when they do get it, it hits them so much harder. And it will wipe them out. Or it'll put them in the hospital, or they'll go in palliative or something like that, and their suffering is so much longer when it could have been completely preventable.
Okay. And then, so you were a healthcare aide, now you're in the nursing program. Why did you decide to switch into that?
The scope of practice for a healthcare aide is very minimal, and it varies to what institute you're in. And I felt like as a healthcare aide, it was great to help people do their activities of daily living, but I wasn't really like making them better. I was just helping them. Whereas nursing, we have the ability to improve situations, we can diagnose things, we can give them meds, we can, advise them on things, and healthcare aides can't do that.
Do you kind of wish that you had gone with a nursing degree before being a healthcare aide, or do you like having that as a background?
No, this was perfect because when I went into the healthcare aide program, I didn't think I was going to like it, and it was just like, whatever, I'll just take it, get a good job, and see where it takes me. And ultimately, being in the healthcare aid industry is what pushed me forward into nursing. And I think had I jumped into nursing with 2 feet, I would have felt overwhelmed, and like a lot of the students in my class have no idea what they're getting into, and it's going to be a big shock when they do start running into situations that I've already handled as a healthcare aide.
So what are some situations that you've handled that you think that might shock your other classmates?
I have a lot of experience with palliative care, so dying people. I've had a lot of experience with seniors and dementia. I've had psych experience, infection experiences. Those are the kind of things that sound a lot worse when you don't know what you're expecting. But once you've experienced it a few times, it's kind of becomes a routine.
Kind of get used to it a little bit?
Yep.
So then, like John asked earlier, do you have to kind of take care of yourself, the mental aspect of it, when you're seeing people dying or kind of doing stuff like that?
Totally. You have to leave your heart at the door. And that's probably the hardest part, is it's great to go into work and it's great to care for people, but you have to leave your emotions and their problems and how you're caring for them at the door when you go home, because you will run yourself ragged worrying about the things that you have no control over. And that's probably, it's just so difficult because you just want to do everything you can for them, but then when you have a situation where you have 7 patients on your rotation, you can't give all of your attention to one person, and you can't take all of their problems home with you.
Do you think that hospitals are understaffed with nurses if they have 7 people on a rotation and not enough nurses to give them that care?
I think it's situational. I definitely think that there are some floors specifically like the NICU and ICU and things like that, where yeah, you should have a lot of staff, and these people are dealing with things that can change in an instant. Whereas if you go post-op or day surgery, you know what that person's coming out with, and it's just a recovery period.
Okay. Do you have a certain floor that you would want to work on once you're done school?
Not sure if I want to be in the hospital yet. I am big in public health and I'm big in education, and for me, taking my immunization ticket and working in public health would be a good direction.
So being the person to give the vaccines kind of thing?
Yep.
Educating people to do that?
You know it.
Definitely. So I'm guessing that you are also, like, you try and push your friends to get vaccines or stuff like that if you can.
Yeah, I'm that person. Did you get it? Did you get it yet? Did you get your vaccine? Yeah, you should get it. But it's like huge argument for me when people are like, oh, cough, cough, like I got the flu shot and now I'm so sick. Like, flu shot made me so sick. It's the
Not
most
true.
irritating thing on the planet. It's not possible.
Great work, Kim.